Phil, that was remarkable. All of the speakers have been fantastic. For those who still have the Zinsfleisch, we are not done. We're going to try to respond to the questions that Jeff and others have brought forward. The good news is that 80 questions have come forward. The bad news is we only have about 15 or 20 minutes. I've tried to do my best to select the questions I think have the broadest reach, and we'll turn them over to the panel. I'll ask the panel to please come up. And at the end of the panel, Jonathan Golden from Jewish Family and Child Service is going to say a few concluding remarks and express our appreciation to the participants. So the first question, Ori, looking back, what would you tell yourself as a 14-year-old now, knowing what you know?
Don't take that first one. Knowing what I know now, I guess you're never given that warning where if you know, this is the one that's going to put you over the top. And knowing what I know now, I know that when I do something like that and I get that kind of pleasure from it, that it's probably not good for me. And I guess that the safest thing would be to ask questions and to really just stay away from those kinds of people who are doing those kinds of behaviors, because I see something, I try it, I like it, I love it, and it takes over.
What keeps you clean?
I guess that one's for me again. I go weekly. I go weekly to 12-step meetings. I stay involved. Someone always told me if you stay in the middle of recovery, and you put the more people that you put in your life, the more positive influences you have, the harder it is to slip. If this was a bottle of liquor, I'm just as close to it. I'm one arm's length away. But the more positive influences I have in my life, the less of a desire there's going to be. A big slogan that I always learned is those who do service are those who stay clean. And you know, by the grace of God, one day at a time, it's been, you know, just over 10 years without taking one. So just stay in the middle of the recovery.
Thank you, Ori. A question for the panel. Are children of Holocaust survivors more or less likely to have addiction issues? Complicated question. Maybe I'll comment. I think that children of Holocaust survivors are not homogeneous. They're a broad spectrum, and they represent children who have who've benefited from enormous resilience that's passed on from their parents on one part of the continuum. On the other part of the continuum, children who've been exposed to the experience of trauma that their parents experience, either through narrative, through stories, sometimes through the experience of living with a parent who's been traumatized. So the answer from my vantage point is that children of Holocaust survivors are both more and less likely to have addiction issues. I think it depends on many, many factors, as we've heard through the course of the evening today. Next question. Where do doctors and other mental health professionals stand with regard to harm reduction as opposed to abstinence?
That also depends. I mean, at ChemH, they call it harm reduction. It's an interesting term too, because I always have a struggle with it myself. Instead, I like calling it actually how to actually get somebody more functional when they're not ready yet to change. And the whole point of harm reduction really is if a person is saying, well, I do want help, but I'm not ready to stop, how do you keep them engaged long enough to actually make the change? Even 12-step programs, although they're abstinent, in the harm reduction world, accepts abstinence as one of the ways to go. as you know, in the first step, before you start the first step, open groups allow people to come even though they're still using. Because you actually still want to engage somebody in some sort of process. The whole thing I was taught with harm reduction approaches was engage, engage, engage. Because you can do the greatest approaches to people, but if you did a great assessment and everything and they hated everything you said, never come back, what was the point? Versus saying, well, okay, you got me intrigued, I'll come back. And eventually, if you're working on goals with them, because it's about making them more functional to get goals, like back to work, back to school, healthy physical bodies, whatever. If the drugs are causing trouble, they have to face it, and eventually they're going to have to make changes. So again, people have different approaches to harm reduction. Harm reduction, from my perspective, is not, it's okay to use substances. We would never say that. That is totally wrong. It's sort of, whoa, I sounded like Trump, whoa. What's going on? I'm being brainwashed. Anyways, maybe I'll hand it over to Jan before, yeah, there you go. Jan, what's your thoughts?
Yeah, I think what Bruce says, I would add, I think what literature says and what my experience says is that abstinence is the optimal, most stable outcome. But as everybody said, it's a long journey to get there. So as Bruce said, we have to get the patients in the door and keep them and retain them, but ultimately abstinence is the most stable outcome. It's for the majority of people, you always hear stories of people who can suddenly control their use, but the majority of people, it's very difficult, if not impossible. So that's where we hope they get to with support.
Let me just add one more thing too. Like, here's just an example about why sometimes it's hard to get someone to stop. Back to Holocaust survivors, any sort of trauma. If somebody starts to cut down, go abstinent, and suddenly they get flashbacks and depression, anxiety, and you haven't yet addressed that, they're going to relapse. So that's why Jan deals with concurrent disorders, so do I. It's about how do you deal with someone holistically, trying to treat all the things at the same time, and what's more prominent and jumping into your face, and dealing with crises first. So that's part of the whole process too, is not just focusing on the substance, but actually focusing on the person in a bio, psychosocial, cultural, spiritual sort of way.
This is a question for the panel. How effective are 12-step groups for these addictions, and are there Jewish versions?
How useful are they? I would probably, just speaking for me personally, I would personally probably be dead without them. Not just hurting, not just in pain, but at the rate I was going, I would probably be dead. Like Phyllis was sharing about Jack's groups, and I've been to many Jack's groups myself, being involved in a community, in a group of like-minded people, in a 12-step meeting with a like-minded solution, it's for me and for most people that I know that have continued lengths of abstinence, 12-step meetings are crucial. Are there a Jewish version? It's all the same. A lot of things that people say, people will come to a 12-step meeting at Jack's, and they'll say, I go to Jack's, when really they're going to a 12-step meeting that just pays nominal rent to Jack's to have a meeting there every week. A big bonus to having Jack's is people feel like they're going to a Jewish place, and yes, maybe more Jews will go there as opposed to feeling like, oh, I'm Jewish, I can't go to a meeting in a church basement. When any rabbi that I've asked, I mean, it's not good to go into the sanctuary, but that's not where the 12-step meetings are taking place. They're usually in the basement, in a classroom, and any rabbi that I've spoken to that has said if it's going to help you stay alive, then you go. So are there Jewish versions? I mean, they could, any two addicts in a room together can call themselves a meeting. So they may have some that are just Jews, but for the most part they're open to everybody and try to focus there not so much on what people look like on the outside, but addiction doesn't discriminate, so we try to focus on what's going on the inside.
How do you support a family member or a friend with an addiction without enabling them? What do you say? What do you do?
That's a whole study in itself. one of the techniques which I didn't speak about tonight is something called CRAFT, community reinforcement and family training. It's a way to learn how to speak to somebody to motivate them to move from A to B to C. And it's actually we do classes on it at Jack's. I'll give you an example. It's a beautiful system. A spouse comes home, the normal situation is the husband comes home, he's drunk, he walks in the door, he says, honey, let's watch the game. What does she say? Because she's got her line. She says, you're disgusting, get away, right? And that's what they do, that's their typical line. So what we do is we learn to analyze their interaction, and we teach her to respond differently. He walks in, he says, honey, let's watch the game. She says, oh, I'd love to. You know, I see you've been drinking. I'm a little uncomfortable. I'm uncomfortable when you drink. I'm going to go to my sister's, see you later. Right? And we work this script over time to the point where he's eventually coming home. He's not drunk. She's got his favorite food ready, and they have a conversation. He may get up in the middle of the game and get a beer. What does she do? No drama, because she's learned a new technique. She will say, oh, you're drinking, I'm uncomfortable, I'll see you later, and she's gone. Right? And amazingly enough, you can move somebody from drinking like that to a whole different lifestyle, and that's one of the techniques we teach at Jack's.
Thank you. Other comments? Phyllis, do you want to respond to that?
So again, this disease, you don't know what to do with it. You see somebody suffering, your loved one, and basically you have to reach out for help. There is no way to know what to do. It's not instinctive. It's actually everything that you do to help somebody is counterintuitive. It's not what you would think you need to do. So therefore, how would you know that? You wouldn't know that. So you must get help and you reach out. If somebody is struggling, just reach out.
Next question. We have a 14-year-old who smokes pot all day, changed friends, steals, abusive. What do? We ground them and they sneak out. Strategies for dealing with a 14-year-old.
So it's kind of a difficult question to ask because there are a lot of details we want to know what's going on, their mental health issues, what is the family structure like. There's a lot of issues that have to be addressed before we can give a simple answer. So I really would have to know more. I would feel comfortable just saying do A, B, or C.
Would you recommend coming to Jack's for a discussion, at least on the part of the parents?
100%. I mean, we have to figure out what's going on with the parents, teach them to many times how to set boundaries.
Other thoughts, comments about that?
Just if you didn't get a chance before you came in to stop by the Jack's booth that we're going to have outside, they're out there afterwards as well. We have all kinds of pamphlets and Bristol boards and cards with phone numbers just for all the different groups that we have, all different services that we have. So whatever the age, the gender, whatever it is that's going on, we have a lot of specific groups depending on what your need might be.
Thank you.
One thing I just kind of say too is, regardless, just make sure you look at safety first. If your parents, I don't know who's asking this, and if it's an actual case, but if you're worried about safety, do not take chances. You can always go to also, well, you can call Jack's, you can call various places, but the key is don't take it lightly. If you're worried about physical safety, like the person's going out, it might be a danger. It's more a question that sometimes you can get the police involved. They go, I don't want to get the police involved. Just like we were talking about before, like sometimes, as you were saying before, it's better to do something than say cottage later on. And it's better sometimes to err on the side of caution versus waiting.
Next question. What would you recommend as a first step in the treatment for an individual who has both bipolar disorder and alcohol addiction?
Sorry to be self-referencing, but I would say see a mental health counselor and recommending psychiatric involvement early on because with a bipolar disorder, it's hard to get away from medication. So we want this person to be able to have access to medication, but they also have to be engaged. So, but I would want to get a physician involved early, but I think what's important is it's a team, right? It's not one person, it's a team. So you want some physician involvement, but at the end of the day, there's so many different ways people can get well, so having a counselor, having somebody they can get help with, and my patients with concern disorders benefit from 12-step, and so that's the good thing, is there's so many different ways to get well, but with the bipolar piece, I would just say make sure there's a physician in there early on.
Now for a really controversial question. What do the panel think about the impending legislation that will legalize marijuana?
Well, I think it's being rushed way too fast. I mean, whether it's going to be legalized or not, it needs to come with education. The problem, of course, is like all substances, you know, a lot of people here might drink alcohol who do not develop addiction problems. There might be people who use cannabis who will not develop problems with cannabis, but there's going to be a large percentage of people who are vulnerable who will develop it. And who are those people? And I think it behooves us, again, from a public health perspective, to actually prepare all of that if it was going to go forward, which I don't see actually happening, but just some rush. So I'm highly, highly worried it's going to create a huge problem in the addiction field. Just on the side, for the medical marijuana side of things, because I deal with a lot of chronic pain situations and so on, it seems everyone and their dog almost got a prescription for medical marijuana right now. And it's growing and growing and growing. And so it's going to be an epidemic, I believe, if we're not careful.
We see this as a problem at Jack's already. The THC level that was in the 60s and 70s was 6-8%. Today they're talking 18 to 20%. It is a totally different drug, a totally different creature. There's a lot of psychosis associated with young children smoking marijuana. They're coming in, they're having really bad reactions to it. Getting addicted, it's affects their memory, it affects their motivation. It is so common today that I will have somebody in their early 20s to mid 30s, they walk in and they sit down and they say, you know what, I'm just kind of not really getting on with my life. And I say, how much are you smoking? And they think I'm a prophet. Right? The reality is that is the drug that damages lives that way. You don't smoke and get into a bar fight and do crazy things like that generally, but it destroys lives. So that from our perspective, that is a great concern.
I think we'll take one last question. If addictions are considered a chronic mental illness, can one be fully recovered? What does recovery look like?
I mean, I think you've seen recovery can take many different journeys, many different forms, right? That's why I think it's so important to find hope. I find that very hard to predict. I have patients in my office who I think are not going to make it till the next month, and 2 years later, they turn their lives around. And I have patients who I think are going to get well, and people are saying cottage. So I think recovery looks different for different people in different ways, and the recoveries can look like Ori here, and then we have tragedies and everything in between. So that's why I think it's important to hope and keep trying, because we don't know who's going to be able to get to that side, but the good news is many people can. But it's a sloppy, for many people it's a sloppy up and down process that can take literally, I mean, you heard it right from Phyllis, it's 5 years in, and it can take a very long time.
I just want to say that recovery, to be in recovery, to be recovered, I think it is possible. But I think it takes tons of work. You can never, like Ori said, you can never let your guard down, because that temptation is always there. So how do you get rid of the temptation is by constantly doing the work. If you're in this 12-step program, so that is a program for life. It's not something that you do and you say, okay, now I'm cured and I stop. I think whatever the technique a person uses, certainly in the 12 steps, it has to be ongoing so that they stay and live in recovery. And that means constant work, meetings all the time, and that's just the way it is. But it's actually, I want to just say one thing, is that a recovered addict is the nicest, best person you ever would want to meet, because they are no longer selfish, and everything is about, what can I do to help someone else? So it's actually something worthwhile looking into and studying for anybody. It's just a beautiful way to live.
Well, again, one of the tenets in healthcare is also matching treatment to the person's needs. And again, I'm not sure if anyone can completely say they are recovered versus they're always in recovery and having a stable life, like eating healthy, exercising every day. I don't know how you sometimes go off diets and then you have to make up for it. Same thing here is someone could be stable for many years and then a trauma occurs or a death occurs in the family and it causes a relapse. Relapses are common. They're not something that people should feel guilty over. It's more like when you're under high stress, you might go to more meetings or you might need extra sort of help. It gets back to taking ownership of your life day to day and knowing what you need and accepting that intensity of treatment at the right time. Otherwise, you might set yourself up. Because I have seen people who sometimes have been in recovery for a long time and they're afraid to get help because they feel embarrassed that they've been doing so well for so many years that they can still be human. And the reality is we're all human and we can all slip at any time if we're not careful. So the key is chronic conditions need chronic care. You might not need intense care all the time, but to constantly keep an eye on it. It's like people with diabetes have to keep watching what they eat. So you gotta watch what you do. This is my humble opinion.
I can definitely say that I'm recovered from a hopeless state of being, from someone who needed to wake up and do drugs every day just to be able to feel or not feel, whatever it is. But I definitely believe that, you know, with 12-step and with going to other outside groups, that it's a day at a time. If I rest on my laurels, if I just say I'm going to coast on what I've learned so far, I'm not going to last very long. The more that I help other people, the more that I come out to more speaking engagements like this, or being there for the person who walks into Jack's, the better chance that I have of being able to give from overflow. The more I work on myself, the more I stay, you know, grounded and fit recovery-wise, the more I'll have to give, and the better chance I'm giving myself of another day sober.
All right. Folks, we're just about at the conclusion of the evening. I'm very glad to ask Jonathan Golden, clinical psychologist and the Director of Clinical Services at JFNCS, to offer some concluding remarks and also to extend our gratitude to the community partners who've been represented here this evening. John?
What an incredibly powerful and rich evening we just shared together. The fact that so many came out to listen and learn about an important topic that affects people in our lives, the people in our families, in our community, at our workplaces, is an empowering and hopeful accomplishment. We know that some of the initial and possibly most important steps to recovery include overcoming denial, becoming educated, learning about the issues. As I stand here at the end of our evening, I sense that everyone here has grown a little in terms of coming together and leaving with a greater sense of awareness, education, and willingness to do their part in breaking the stigma for substance abuse and behavioral addictions. As good as any workshop or evening can be, a key goal should always involve having the event influence ongoing change and dialogue. And given that we know an important proportion of individuals who are dealing with issues of mental health have co-occurring substance and addiction challenges, it only highlights the need for all of us providing services to clients to collaborate and to ensure we meet their needs by relying upon and benefiting from each other's unique areas of expertise and specialization. As Director of Clinical Service at Jewish Family and Child, I am pleased to say that having Dr. Jan Milot from CAMH providing regular consultation to our mental health counseling services is evidence of this commitment, and it represents an important asset to our clients, our staff, and the agency. And David Kaufman from JAX has also come to JFNCS to meet with staff in order to help educate, as well as outline some programming and processes for ongoing collaboration between our two agencies. Our client services at Jewish Family and Child are broad and include individual family counseling, poverty reduction programs, some chaplaincy services, and adult socialization groups, to list a few. And an evening like the one we had tonight only highlights the need for each of our programs to collaborate in an interdisciplinary, cross-agency, and a cross-sector manner in order to meet the complex needs of the clients we serve. And speaking of partnering and working together across the GTA, you can all appreciate that an evening like the one we had tonight does not come together on its own. As we close off for the night, I want to acknowledge and thank the key players and their associated organizations who made this happen. First, and in no particular order, I would like to thank our 3 supporting rabbis, Rabbi Friedman Cole, Rabbi Strachler, and Rabbi Cutler, Bob Cherniak and Yaakov Fruchter from Basedek, Jeff Lipschitz from Sherish Shemayim, Marley Moseson and Deborah Quinter from Mount Sinai. And a tremendous thank you also goes out to our panelists, to Ori Goldstein and Phyllis Ben-Susam for their powerful and open and honest accounts of lived experience, as well as Dr. Jan Malat and Dr. Bruce Ballin and David Kaufman for sharing their unique professional expertise. Finally, I'd like to extend a special thank you to our moderator this evening, Dr. Mohan Lesh, who was in fact the driving force behind this entire event. It was Mohan who called the meetings. He made sure all things were moving in their own proper sync, and the one who was responsible for helping to ensure that the important evening we had happened and was as successful as it was. That now brings me to all of you sitting in the audience this evening. You are the ones who are ultimately responsible for the success of this evening. Your interest and openness to listen, to ask, and we heard lots of that, and to learn about this important topic are the key ingredients for moving this issue beyond the walls of Basedek and into real-life discussions and actions. Your involvement and activity beyond tonight is the key that will help all of us break the stigma for substance abuse and behavioral addictions and hopefully lead to positive change. The exciting part is that everyone in this room holds the potential for generating real-life constructive change when it comes to stigma and addictions. Thank you all and have a good night.